13 is on your side.
Now on Evening Plus, the CDC says in 2023 there were nearly 300 overdose deaths per day in the United States. Joining me now in studio, Anthony Muller, Vice President of Substance Use Disorder Services and Clinical Services Development at Samaritas. That is one of Michigan's largest nonprofit health and human services organizations. Anthony, thanks so much for being here tonight. This is such an important topic. We know that this is an issue that affects people here in our community and in communities across the country and across the world. For anyone who isn't familiar, Samaritas has been around for decades and decades in our community. But anyone who's hearing about you guys for the first time, what sorts of services do you provide for people?
Sure. Yeah, we've been around for 91 years, and we have 4 big services that we do. My role is I lead our behavioral health program, which does everything from substance use to mental health to trauma assessments. We also have a refugee program, one of the largest refugee resettlement organizations in Michigan. We do family services, really working with people who are kids, especially in families who are going through abuse, neglect, and foster care, preservation. And then we also do a lot of affordable housing for seniors. So low-income housing for seniors, one of the most wonderful. I mean, we are a service organization,
do a lot, yeah.
But being able to offer beautiful properties to seniors with low income is one of the things I just really love about our organization.
Yeah, absolutely. And you guys do so much. You hit a lot of different sectors of helping people in our community in need in a lot of different ways. When it comes specifically to substance use disorders, and of course we're coming up in just a couple of days on Overdose Awareness Day. This is an issue that's been around and it's going to continue to be around. Why is it important for us to be talking about this more?
Yeah, I think the more awareness there is, the better outcomes can be. So we had 2023 data that we looked at. It's about 105,000 overdoses. If there is good news, 2024 data is 83,000. It's down 27%. Part of that is because of awareness that is going around. Yeah. Part of that is because of Narcan. Part of that is because of easy access to medication-assisted treatment. But this conversation we're having right now is, first of all, important to honor those individuals and support those families, but also to talk about just the fact that recovery can happen and that with this conversation, progress does happen.
And I think it's important to talk about, too, even if you personally haven't dealt with a substance use disorder, potentially you know someone who has, or you know someone who knows someone, right. It's really something that can be present in many people's lives. Mm-hmm. And in the name, it is a disorder. It's, it's a disease that someone is dealing with. And while difficult and stigmatized in a lot of ways, it's, similar to other diseases, disorders, it's something that needs treatment and care in order to improve.
Absolutely. And, the stats are roughly 17% of Americans would hit diagnosis for a substance use disorder. Not all those people are aware of that or are willing to work on that, but it is something that affects every family, if you look a little bit farther in the family, sometimes really immediately. Yeah. So it is definitely something. And we do know that we have evidence-based practices that do show outcomes. And so there is help for people.
And for someone who may know someone, or maybe they're wondering if they are struggling themselves with, in fact, a substance use disorder, it's a complicated process. It can take a long time to get to that point of recovery, sure. But it's one that is possible, as you just mentioned. If folks are looking at just some very first initial steps to be taking, mm-hmm. What kind of advice can you provide there? Yeah,
I would say if someone is at the place where they are thinking about, do I have a substance use disorder? They probably have a substance use disorder, yeah. Just from the nature of the disease itself. And even in the beginning process of the development model recovery, one of the first steps is identifying some life problems. So if people are seeing that, then there's probably something more there. Being able to reach out to a friend, a family member, someone they trust to care for. Obviously, there's lots of help, like our organization, yeah. Samaritas. There are many good organizations that serve people, but that would be another really practical step. Again, if you think maybe you have a problem, you probably ought to get an evaluation on it, because the chances are pretty good if you think you have a problem.
And we were talking right before this interview. I mean, this is a field that you have worked in for decades at this point. When obviously recovery is possible, and relapse is also possible. But when you're seeing someone who is initially dealing with this disease and they're able to get to that side of recovery, mm-hmm. From your experience, what does that look like as far as the transformation that's possible in somebody's life? Yeah, no, it's an honor to be able to work in the field that I work in. It is a blessing. 29 years is what I've spent into that. Yeah. And being able to see someone's life move from just a place where there's chaos and chaotic and sometimes don't know
what the next step to be to someone who has a stability, who has rebuilt relationships, often with family, sometimes with new supports, always with new supports, but the rebridging that, someone who has self-awareness, someone who has gained self-control and mastery over themselves, someone who has the coping skills, someone who's a productive member of society, someone who it feels good about themselves and the pride that's there. Those stories, people in recovery are remarkable people. They have had to overcome. I know a lot of times we think of someone who's using substances and there's a negative connotation that often comes to our mind, and that's something we need to work on. And I don't think we often also give people in recovery as much credit as they deserve as well.
Yeah, and we've touched on it a couple times in this conversation, but when it comes to that stigma, if I, for example, have never dealt with a substance use disorder personally, what can I be doing, kind of on the other end of things to be working, to eliminate that stigma? What can be done on kind of the other side of the picture?
Sure, I think part of it is just some empathy. We all struggle with something.
Yes.
And when we are, it's very easy. It takes no emotional energy to blame somebody, to argue. We could look at, and we're not going to get into a political conversation about anything at all. But we can see models in our world where people are not taking a look at themselves and they're putting pressure, blame on other people. Let's just take some responsibility for the way we talk to our child that wasn't kind. Those type of behaviors and actions are real building blocks towards being able to have empathy for other people. It doesn't mean that people don't have things to work on. It just means that we can share love and concern for people while we do that.
And I know you mentioned that, we have seen this decline in the overdose death numbers, which is great news. But of course, we're still seeing tens of thousands of deaths per year, which is still a huge problem. I know you don't have the magic, what am I trying to say? Kind of the fortune ball to, look at to fix that problem. From your standpoint, working with an organization that works to help people here in our community, kind of, I guess, big picture, any ideas on your end on what we can continue to do here in West Michigan to alleviate those numbers?
I think these conversations are really important. We have Narcan readily available. I think we've done a good job of, people are at biggest risk overdosing when they maybe come out of a residential placement or jail and going back and using amount they were using before. So really making sure people are connected to services before they leave. And so just really doing, full person care, but thinking about the arc of someone's experience and making sure that support's there is really important.
Yeah, and I want to pull up the information for you guys at Samaritas, just in case anyone wants to reach out to you guys personally, your phone number, your address there, also an email address. Again, we touched on it, but if someone is hearing about this and they'd like to reach out for help at this point, tonight, tomorrow, what does that avenue look like through you guys? Yeah,
as they reach out to us, we'll have someone that will get back to them same day, not tonight, but tomorrow. Be able to talk about what their needs are, get them scheduled. We try to get people scheduled for assessments within a couple days. And I guess one other thing I would mention is we do have services available in Ionia, Holland, and also in Greenville. So when we're looking at the catchment of this studio, those would be areas as well. Same phone number, one phone number we can get to get people connected.
And I know, that first step can oftentimes be the most daunting for people. And looking at a journey to recovery may look like a huge mountain to climb. What's your word to folks that finding that side of recovery is possible? Yeah, absolutely. That first step is very difficult for people, and just sometimes angst or shame. Or we are an organization that is here to serve people, and my team is here because they want to be helpful. So people who walk through our doors are going to be greeted with someone who is doing their best to have that empathy we talked about, who has been working on themselves as well, because as a clinician, we are the best for our clients when we have been working on ourselves, and that's something that we really stress. So it doesn't mean it's going to be a perfect experience for every single person, but know that there are lots of organizations, but our organization specifically is working very hard on preparing ourselves and being welcoming to people, because it's hard for someone to take that first step. Yes. It's courageous for people to take that first step, and if we don't engage people and acknowledge that, then it's going to be difficult. And so philosophically, we make sure that that's how we approach people. Yeah, absolutely. All right, Anthony, well, I so appreciate you being here talking about this. Like you said, it's so important to just be talking about it, to cut down on that stigma as much as we can. Again, Anthony's with Samaritas. You can find much more information on their website if you're interested in the services that they offer. Thank you so much for being here and talking about this. I really appreciate it. We're going to take a